And we've got some, thank you, Laura for recording. We've got some content to share with you today, and then we'll have some time at the end for questions. So I will let Dr. Sun and Dr. Coventry introduce themselves, and then we'll get going.
Hello, everyone. I'm Dr. Sun, or welcome, call me Jin. I'm one of the fellow physicians is going to present today. And here we also have Dr. Coventry.
Hi, that's me. Good to meet all of you. Hope this is helpful.
Awesome. So we're going to move through content today. For those that are just joining, feel free to put your name and the age of your kiddo in the chat. And we will move through kind of the information we're going to share, and then we'll have time at the end for questions. So if you have questions as we go, write them down and we can field questions at the end. So, all right, Dr. Sun, you're up.
All right, thank you, thank you. Yeah, so today we're going to share some information, hopefully to be helpful, about how to support healthy sleep in young kids. And here we go. So here's the outline that we're going to talk about how much sleep kids need and how to promote independent sleep and also the good habits to put kids to sleep and also how to manage toddler and preschool sleep challenges. So first, how much sleep does my kid need and why? Okay. Anyone want to share that all right, how about this? Raise your hand if you pretty sure exactly how much sleep your kids need.
Anybody have any idea how much sleep they think their kid should get? Perfect. That's why we're here. Faith going 8 hours. Okay. I like it. Faith going 8. Jacqueline, what were you saying? You're muted. Oh, she's not sure. Okay.
Sorry, I hit the wrong dang button.
That's all right.
8 to 10 hours about then.
8 to 10 hours. Okay.
Yeah.
Great.
Yeah, awesome. Thanks for sharing. Yeah, so it's kind of tricky because the need of sleep for a different age group are very different. And here we come some information about it. So first is it's not only about the time, but also about the quality and schedule. So it's pretty important to keep the schedule regular, like every day go to bed and wake up at the same time. And also the quality is important that we have to make sure our kid does not have frequent nighttime wake up and also not snoring at night. And here is the sleep time recommendation. So here we can see when the kid is pretty young, like less than 1 year old, they sleep for a long time, like 12 to 16 hours. And when they get older and older, you can see the time start to decrease a little bit, like more like adult schedule. And also, this is just a reference. If your kids sleep a little bit different from this and they're doing well, then that should be fine as well. And here we have the recommendation from WHO or World Health Organization, a fancy institution, like the recommendation about sleep. Here we can see for infant less than 1 year old, we generally recommend them to sleep like 14 to 17 hours before they are 3 months old. And then for those kids are like 4 to 11 months old, we recommend 12 to 16 hours. And here we can also see some other information over here, like the physical activity and also the screen time, because those are so important. They can affect sleep. So for kids this young, we recommend them become physically active at least 30 minutes per day. And by say physically active, we mean they are doing floor-based play, like they are playing, they're laughing, or kind of just on their tummy, like tummy time, happy with their parent. And here we also see in the middle about the screen time, for kids is so young, we recommend no screen time, which means no phone, no iPad, and no television. And when kids become a little bit older, like 1 to 2 year old, sleep duration become a little bit less, like 11 to 14 hours, still pretty long, I know. And physical activity is become 180 minutes in various kind of activity. And for the screen time, before 1 year old, still no screen time. And for those kids are 2 year old, 16 minutes is okay-ish, okay-ish, like not necessary, just okay-ish. And when kids become even older, like 3 to 4 year old, a couple of things we can see over here. First is their sleep time of need continue to decrease. And the other thing is about physical activity. Now we not only emphasize the importance of 180 minutes per day, but also we suggest at least 60 minutes of moderate to vigorous activity. And by saying that, which means kids are either running or playing chasing game or playing sports. And for moderate activity, that means kind of walking or like doing some lower intensity like activities with parents. And here are some benefits with good sleep. So a lot of research has pointed out that if kids can sleep well, like they can do much better in many, many things. And here we can see they will have better mental health status, better physical health, better in attention, emotion regulation, and less behavior disturbance. Also, they will perform better in learning and with better memory performance, and eventually have better quality of life. So now we got to a very important thing, like to start with, like how to let kids sleep safely. So kids are always in some sort of dangers, including sleep. They can have some accidentally suffocate themselves, especially infants which are very, very young, like sudden infant death syndrome that we absolutely want to avoid. So a couple of things we can start. First is the safe sleep tips for infant less than 1 year old. First is we want them to sleep on their back, like not on the side and not on their tummy. And also we want them to sleep in the crib. And also we want the crib doesn't include some like fluffy or some like uneven surface, which means we recommend a firm mattress with a flat sheet. So no blanket, no stuffed animal, just an empty crib. That will be the safest. And when kids become a little bit older, when they are able to turn around or flip over by themselves or through position, then they will start to become safe to sleep in any position. And when they are getting even older, like 18-month-old, they can start to slowly transition to a toddler bed if they are okay with. And they are still okay, and they become okay to sleep with blanket and small pillow, etc. But one important thing is don't put a huge stuffed animal in their bed, because toddlers are very capable of climbing, so they might step on the stuffed animal and climb up the crib by accident. And also make sure the crib is away from windows and electronic cords or things include stream that they could possibly accidentally hurt themselves. And some other sleep tips for kids are older, like preschool age. First is we recommend to keep the night lights on for safety, because if you want to check on your kid at the middle of the night, then you can always have a better situation you can observe. And the second thing is about sleepwalking. So sleepwalking is kind of common in kids age 4 to 12-year-old. So they usually grow out of it. So those are usually just disappear when they are getting older into teenagers group. But also we don't want them to encounter dangers when they are sleepwalking. So if you notice your kid is a sleepwalker, then don't let them sleep on the top bunk. So even if they are wandering around, they won't fall out from the bed. And also if you witness they are sleepwalking, don't try to wake them up or try to hold them. Just calmly redirect them. And a regular sleep schedule can improve this kind of situation a bit. And also got to make sure the environment is safe, like window doors are locked. And also there's no additional object that kids can trip on. Then here comes the habit that can support health sleep. So we recommend to have a bedtime routine. And about the routine, we suggest people start to build a routine when the kid is very, very young, like 6 to 8 weeks, even though they not yet started to become really capable of keep the routine. And here is some recommendation from the American Academy of Pediatrics called Brush, Book, Bed, which means brush the teeth, read a book, and then go to bed, which I found very interesting.
Ching,
So-
can I chime in really quick on this one?
Oh,
Is that
yeah,
okay? Can I add something? I think, you know, part of what we know about sleep hygiene in kids, and I'm looking at the ages here, and most of the folks that are on the call, their kids are like preschool age, so 4 or 5 year olds, a couple 2-year-old. Just because you maybe don't have a consistent bedtime routine yet, or it might come and go, kind of depending on what your family does, having a moderately consistent time and then just the same predictable series of events is really what's most important. So for tiny babies who aren't brushing their teeth yet, this might look like bath, book, bed. I have kids, you guys the same age, and we usually do bath, 2 books, and get in bed. The benefit of having the routine is that, like, no matter who puts your kid to sleep, your kid will know that predictably this is what happens. And if you have a kiddo who's having a hard time staying in their room, staying in bed, usually what we want to do is kind of start making sure that the bedtime routine is consistent before we move on to some of these other considerations that Audrey's going to talk about later. So either in the chat or, you know, on the screen, feel free to give a thumbs up if you feel like, yeah, my kid has a pretty good bedtime routine. Like, we mostly do the same thing each night. Or maybe a thumbs down if you're like, it's something we're working on and I have some questions about it. So that we can kind of figure out where we're at with content and questions about things. Faven's like, nope, I'm working on my routines in my house. Faith owning it. I like it. Okay. The main thing around sleep, especially when you're going from sort of the 2 to 5 year old range, is that consistency is key and predictability is key. She wants her, Faven says she sleeps with me constantly and wants her feet rubbed or being held. Yeah. She wants her mama. We're going to talk a little bit more about, as we move through some of the other recommendations, we're going to talk a little bit more about kind of pros and cons of co-sleeping and not co-sleeping. And the most important thing to keep in mind is we want not just kiddos to get good sleep, but parents to get good sleep too. So if those things are not happening, then maybe the routine's working for the kid, but it's not working for you. That's a great time to think about some of these things we're going to talk about today and what might be helpful to make sure you're getting good sleep and your kid's getting good sleep. All right. Ching, you're going to talk a little bit more about routines for different ages, right?
Yeah.
Okay, perfect. Thanks.
Yeah. And actually, I want to focus on the book part because for most parents, brushing the teeth is relatively straightforward. And if questions can go to dentists as well, the reading book part is usually the challenging one. So I put some more information here. So for the kids who is younger, like 6-month-old to 11 months old, they are actually being capable of involved in reading as well, even though they don't really understand. So people can try to point at the pictures and play games with them. If they make a noise or react to the book, then parents can try to mimic their reaction to build some connection. And for kid is like a little bit older, like 12 months old, like 1 year old, then we can start to ask them simple questions that they are capable to answer. Like, where's the dog? Or where's the baby? And if they are making the noise, then we can reciprocate that as well. So the kid will have a sense of connection. And for kids who are even older, like preschool age, 4-year-old and older, Then it's time to have some more complex question. Like we can ask the kid how is their thought about the story, or ask the kids to explain the story to you. And also we can use that time to have a little bit learning, like pointing out color, shape, number, or letters. And also, this is time to try to introduce the kids to library. You can bring the kids to library and suggest them to pick a book or two for the story time. Right. And here are some bedtime routine do's and don'ts. Do's is, as Megan says, do it every day, keep the routine, and keep it short and sweet. The kids usually don't have patience for sitting for too long. And also listen to a kid to see if they like it. And also follow sleep hygiene routine, and make sure if you're making any change, those should be gradual. And on the right side are the don'ts, like don't start when they're already sleepy, like don't wake them up to do the routine. And also don't let them use the screen, so no screen time. The general like sleep hygiene as well. And don't let them run around or do some very intense activity like rustle around or like playing some intense game. And avoid sugar treats or caffeine. And also pick the story smartly. Like don't tell them a horror story. And in the weekend, we still have to keep the routine. Okay. And here,
I wanted to just add one more thing to that. If you can go back to the last slide. So most families probably already know this, but I'll just reemphasize it. So the way that light from a phone or a screen impacts our brain is that it keeps it more awake. So sometimes families will put on like a show or something for a kiddo to watch as they fall asleep. And that's a really tricky thing, because it's actually working against you and getting able to let your kiddo sleep independently, because it's keeping the active parts in your brain awake. Same thing with us on our own phones, right? If we're scrolling, that actually impacts our ability to fall asleep quickly. So we really recommend no screen time an hour, and if you 30 minutes is kind of pushing it, before your bedtime routine. So I want you to think about turning your screens off 30 minutes before you're starting your brush, book, bed routine. The other piece that I'll add to this is that there's a very, and Ching, you could go to the next slide because I think you're going to talk about this, but there's a very unique wake window and sleep window where your kid is not overtired. That's your best chance at having success. And so I'll pass it back to you, Ching, to talk a little bit more about melatonin, which is like the hormone in our brain that helps us sleep, and what folks can think about in terms of how to use that to your advantage.
Yeah, sure. So you can see here that we are recommending people to get in the bed around 7 to 8 p.m. And here is why. The melatonin, the hormone in the brain. So there is a sleep-wake system in human body to regulate the sleep. And the hormone to do the trick called melatonin. The more melatonin we have, the more likely we feel tired and want to go to sleep. And you can see from the picture over here, like when it's about 7-ish, 8, the melatonin started to elevate. So increase, and then peak around sometime a little bit after 12, and then start to go down. So the sweet spot of trying to get kids to sleep is around the 7 to 8 p.m. because that's the time melatonin starts to raise. And just as Megan say, when kid is overtired, which means the melatonin schedule is already been cranking up like high over there and probably almost start to fall, and that will make the sleep more difficult. And next thing, just want to remind everyone is naps count as well. So when we come to sleep, we have to take the naps time like counting as a part of sleep time. And on left side is a table for young kids about how many naps they can have and about the times. And the right side, I list some general recommendation on the nap time and for how long the kids can take during the daytime. And still, this is just a general recommendation. If your kids is doing this differently, but they're fine, then it should be good. And here is a tip about to calm a kid who is not wanting to sleep. There's a very interesting research did by a Japan scholar saying that if a kid is very active crying, doesn't want to sleep, the best strategy to calm them, like the infant, will be hold them, walk for 5 minutes, and sit for 8 minutes, and put them back to the crib. All right. Then here I'm going to handle the presentation to my colleague Audrey.
Yeah, so now we're just gonna go through some tips on how to sleep through the night independently. Some parents really prioritize sleep training, so really trying to get their baby or toddler on more of a consistent sleep schedule. But really these kinds of things apply regardless. It's more like letting your kid be able to sleep even if you're not right there responding every single time they make a fuss. For your sake also, because being a parent is hard and exhausting. So some of these tips we've already talked through, establishing a bedtime routine, timing it where the kid is a little sleepy but not overly tired yet. Avoiding sleep training during life transitions, just because it can be a really stressful time, kind of chaotic, and it's best if you and the child have patience to go through and tolerate this kind of adjustment. Give your child space. So, as tempting as it is to run into their room right away when they start crying, to rescue them and to stop the crying, kind of follow the plan that you've set and be consistent with that. Next slide. So here is an example of sleep training. Again, this is used often for parents at around the 6-month age for their kid, when their baby is kind of adjusting from the newborn sleep schedule to more of a consistent one. But these steps can be applied really for any age kids, and I know a lot of you have older children. So if there's been a disruption in the sleep routine and you're just having a hard time getting things back on track, or if your kid is really fussy at night and needs a lot of your attention. So this is called the 7-day sleep method. So day one, you teach a routine to really reinforce the difference between night and day. So waking up your kid relatively early at the same time every day, getting use of a lot of natural light, at bedtime, making the room really dark and quiet, and just setting that routine. Next day, you practice the routine, use the same time, the same bedtime cues, all the bedtime strategies that Dr. Song talked about. And then day 3, you want to put the child to bed while they're still awake, so that way they learn, like, okay, I didn't fall asleep and wake up in my bed. I'm learning that this is the go to bed time, and this is how going to bed works. And then again, if the kid is fussing or crying, it's okay to check in every few minutes, make sure they're okay, but just keep it brief, just reassure them and then leave. And then try to keep the lights off, avoid, giving extra snacks or things, because that can actually teach the kid that, oh, I need this extra snack, I need this extra treat, I need this extra toy in order to fall asleep. So if you avoid those as much as you can, they can really help promote their independence while sleeping, as hard as it is at the beginning. And then day 4, you can space out how long you take between checking in. So if day 3 you started 5 minutes, maybe day 4 you wait 10 minutes. The next day, lengthen it a little bit longer. And this is something, especially if you have an older kid, like 4 or 5-year-old, you can tell them, like, I will be back in 10 minutes. And as long as you follow up on that, they can trust that, and they'll trust that, okay, like, I'm going to be left alone for a little while, but mom or dad said they would be back. And then you come back on time, and that reassures them. And then you kind of follow that routine, space out your check-ins longer and longer, and then that should hopefully be effective. So that's one strategy. Has any parent tried something like this for their kid, either as a baby or when they were a little bit older? maybe not. Okay. Um,
I love how on day 7 it says done, like it's like that easy. Like, oh, you just do these things and then they'll just sleep. Because I think any of us know that it's like it's way harder than it actually, looks here. But I think the point you're articulating really well is that like it's a gradual thing. So we're fading the amount of support that kids need over time, as opposed to just saying, now you're going to sleep all by yourself and I'm going to let you, quote unquote, cry it out. And I think what we're not trying to promote here is whether sleep training is right or wrong. We know a lot of research shows that there is no harm in using any of these sleep training techniques that Audrey's going to talk about. And there are also a lot of families that like sleeping together works okay safely. And so these strategies are more like if you're at this point where you're just like, I'm not sure I want my 4-year-old in my bed with me anymore. I'm ready for them to do their own thing. These are some ways that you can think about moving towards independence without it being a really difficult experience for everybody involved. I've done it. It's hard. I'll speak and say I've done it with my kids. It's hard. It's hard for sure.
So this is just another tool that can help when like your kid is fussing at night, you're really not sure what to do to help calm them down. This is a really common strategy that some people use, so it might look familiar. It's called the soothing ladder. Um, it's best for babies, but some of these strategies can be used for older kids too. So entering the room, using your voice to soothe them, offering something like a pacifier, some physical touch that can be comforting to them, maybe a feed. And the key with this is you want to keep each of these steps very brief. So you check in, you reassure, but you don't linger too long to reinforce that, like, oh, I need my parent here to fall asleep. So here are some other sleep training methods. I won't go over them into too much detail. I basically wanted this slide here to say like, hey, if this is something you're interested in, there are a lot of different ways to do this and to help coach your child to be able to sleep on their own and to feel safe while they're sleeping. So the slide will be here and available, but I'll just ask for questions at the end if you have any, but we'll skip over the details for now. So next, we're going to talk about how to manage some common challenges. And from the chat, it seemed like there's a few that are struggling with sleep for their kid, which is completely normal. So first one, basically, why do some kids have such a hard time sleeping? And why does it happen to fall on this, typically the toddler age, that can be so challenging in a lot of other ways? And a lot of this is very normal and expected and a sign that their brain is growing in a healthy way. Toddlers are learning to be independent. They want to call their own shots. And part of that is bedtime. So if your toddler decides one day, no, I'm disagreeing with bedtime, I'm not going to go along with it, you've got a healthy toddler. So it's a good thing, but a frustrating thing. Other things that can affect us, any stressful life change or stress that the child is experiencing. Some kids have separation anxiety, or even if it's not anxiety, they just miss you and they don't want to say goodnight. That's very normal. Changes in routine can affect this. And again, sleep change is a normal part of growth and development. Sleep changes throughout our whole life, and childhood is a part of that. So we're going to talk through 4 common challenges. Doing anything to stall bedtime, escaping from their bed, feeling scared at night, and refusing nap time. Does any parents struggle with any of these? I'm going to assume yes, because we hear that all the time from parents, and I'm sure Dr. Fry, yeah, all the above from Lillian. Okay. Jaquel, thank you. Also, yes. So, okay, so we'll talk through some strategies. So first one, stalling bedtime. Um, super, super common. They had a bedtime routine. It was going great. They were going to bed on time every night, and then light switch, they're not doing that anymore. What do we do? One thing to try is tweaking the bedtime routine a little bit. And part of that, especially since your child is now at the age where they want some power, they want some ability to make decisions. So let them make some of those decisions with you. So you can give them some wiggle room with the routine. Like, do you want 2 kisses or 3 kisses? Do you want this bedtime story or that one? Which pajamas do you want to wear? So that way you're not letting them decide whether they're going to bed, but you're making them feel like they have some control and feel like they're helping in that decision too with these little changes. And that can be exciting and can kind of help the journey. And then we talked about this a little bit earlier, but if you leave the room and they're crying and fussing and it's not getting better, your kid is probably old enough to hear a bit of an explanation of like it's time to sleep. And you can again reassure like I'm gonna come and check on you in 10 minutes, in 15 minutes, and follow through on that, check in for just a little bit, and then leave. Because that again, that'll reassure your kid while not lingering too much. Another idea that some people find helpful is to set a timer together. With your child, say, I'm setting a timer for 5 minutes. Mom or dad, we can stay and cuddle and hang out for 5 minutes, and then it's time for us to go, and it's time for you to go to bed. And again, because it feels more collaborative and it feels like a shared decision, some kids have an easier time getting on board with this.
I would add too that sometimes 10 minutes might be too long to start. Like, I'll be back in 10 minutes. So you might have to start with, I'll be back in 2 minutes. And I'm looking at my watch and I'm showing you, I see, I'll be back at 5:36. And and starting with 2 minutes and then the next night 3 minutes and then, a couple nights later, 5 minutes. It might take a little bit of investment on the front end around the stall bedtime things, but it's much better than the, hour or two of I'm constantly having to put you back in your bed. Um, so if they can't do 10 minutes at the start, that's okay. Start with 2. They might even only be able to do 1.
Next slide. Okay, so what if you've tried the slide before and your kid is just leaving the bed every single time, no matter what the timer, no matter the decision, they're just getting up and finding you every single time. That is exhausting. And the way to overcome this is just persistence. So basically, whenever the kid leaves their bed, just pick them back up or hold their hand, guide them back to their room right away every single time. And that is very difficult to do. And kids are usually very persistent and very stubborn and very eager to not say goodnight to you because they want to keep seeing you. So it can take a couple of weeks or more of just every single time, every single night, getting them, like leading them back to bed. But eventually the kid realizes, okay, no matter what I do, mom or dad is gonna put me back in bed. Like that's it. I have no choice. And eventually they'll kind of settle and learn to stay in their room. But it's just a long process and takes a lot of patience. There's other ideas that some people have found helpful. Hanging bells or something on the kids' doorknob so that you hear when they open the door and you hear them coming earlier. And that just allows you to do a much faster guide back and reinforcement. Another option is just putting in a baby gate. And you can even explain to your child, this is to keep you safe because it can be really dangerous to walk around in the dark and we don't want you getting hurt. Because that way it feels less like a confinement and more like, oh, my parents care about my safety and that's why this is here, is to protect me. Um, doesn't work for every kid, but it can be a good option, especially if you're not able to get up and put them back in bed right away. A lot of kids feel scared at night. Um, Again, this is really normal. Kids this age have a very active imagination, so they're gonna be scared of things that seem completely unreasonable to us and that just seem to come out of the blue, and that's normal. Um, the thing to do here is just recognize their fears, because it's a normal part of being a kid. It's not something that they have a lot of control over. They're just scared and they need to feel safe. Um, so recognize their fear, reassure them that things are okay. And there's a lot of ways to do this. Like common one, there's a monster under the bed or in the closet. Um, some parents say oh, I've used a monster spray to get rid of the monster, or like, oh, I talked to the monster and like he's gonna go away, or something like that, which for some kids can really work and be fine, but for others that can kind of play into the reality of their imagination and make them feel even more scared, like, oh, mom or dad also saw the monster, it must be there. Um, so sometimes just reassuring without that kind of playing into the imagination can be more helpful of like, nope, there's no monster, you're safe, we're watching out for you. Um, and you can also get creative with other things. Like if they like stuffed animals, having a stuffed animal as a like a watch pet or something, just as a separate thing that they can feel like is protecting them. Another common struggle, refusing nap time. This is very common. So all babies need naps, toddlers need naps, but some kids start to not really want or need naps, sometimes as young as 2 or 3. And so it happens pretty often where certain kids around 4 or 5 just don't need naps anymore. Um, so it kind of depends on the child, but especially for younger kids, or kids that are taking regular naps, it can be really tricky skipping naps, because then they get overtired, they don't sleep really well at night, their whole day routine is kind of messed up. So if you have a child that's still needing regular naps, try to abide by that schedule as much as you can. The other thing is the older they get, the less strict you have to be about the time of their nap. So it's more important to kind of follow their cues. So if they're starting to look tired, and this can be getting really clingy, getting kind of spacey or dazed, rubbing their eyes, or even if they're getting over hyper, that's one that often confuses parents. Sometimes over hyper can mean your kid is actually really tired. So that can be a sign that, okay, they're ready for a nap now. Um, so then, um, same as bedtime routine, keep the room quiet and dark and calm. But for some kids, if it's nap time, they seem sleepy, but they're just not sleeping. It can be okay to just say like, okay, this is rest time. You're gonna play quietly. We're gonna keep the room a little dark. Um, and then just go from there and just let them kind of take that as an awake but restful time. The other thing we wanted to talk about is kids who have difficulty sleeping for like medical or psychiatric reasons. So, um, sleep apnea is something that can happen in children. I know for a lot of people, they think of it as kind of an adult disease, but a lot of kids can get sleep apnea. Kids with anxiety or other psychiatric disorders can have trouble sleeping. Other medical conditions can cause trouble sleeping. So, if you've tried everything that we've listed in our presentation so far, your kid is still really struggling to sleep, then it's probably time to talk to their pediatrician and see if there's other workup that they need or other things to try. So we've also listed for your reference, these are some symptoms that your kid might have something else going on that's affecting their sleep. So things to look for in the daytime, if they have headaches in the morning, if they're only breathing through their mouth or they have a really hard time breathing through their nose, if they have trouble learning or paying attention in school, having difficulty at school, if they've developed some behavior challenges. So if they're over hyper, again, hyper can be a sign of fatigue in kids, over impulsive or aggressive, if they're not gaining weight like they should, or if they're just seeming to be really tired during the day and falling asleep when they're not supposed to. Those can all be signs that you need some extra attention. And then things to look for at night, if your child is snoring, if you notice pauses in their breathing, if their sleep seems really restless, it's normal to have a little movement, but if it seems over restless, other breathing trouble like snorting, gasping, coughing, again, breathing through the mouth. If they start to wet the bed again after they've been having dry overnights for a long time, or if their sleep just seems not restful in any other way. All of these can be signs that there's something else going on, and we'd recommend talking to your pediatrician and asking for other testing. So we've covered a lot today. We tried to keep it general, just because we know there's a broad range of challenges with sleep, and we weren't quite sure what the age group was going to be. So I hope for the parents of older children that this was helpful as well. But yeah, we have 15 minutes or so to take any questions that you all have. And these slides you will have access to at the end of it as well.
Thanks, Audrey. Does anyone have specific questions, like, it could be specific to your own kid or just questions about things that we went through, like how to kind of implement some of the strategies in a way that's realistic? Or any additional follow-up things? I wanted to share one thing. Can I share my screen real quick? Jane, can I just show an example of something? Let's see if it will let me. So we talked a little bit about bedtime routines, kind of doing the same thing each evening with your kid. For a lot of kiddos on here that are 4 or 5 years old, having what's called a visual schedule can be super helpful to focus less on the power struggle with you and more on like what their job is to do. And you can even use checklists or gold stars or stickers for how they do their bedtime routine in order to then give them a reward for earning a specific amount of stars. So this is one that I use. I have a 5-year-old. This is one that I use with my 5-year-old who has a lot of challenges with sleep. Let's see if I can share here. Can you all see that? Yes? Okay. So this is just the expectations that we have for him in the evenings, and he checks off his little box with everything he does. I have it like on a dry erase laminated so he can erase. And then each time he does his whole routine, when it's done the next morning, if he's done it all well, I give him 1 star, and we have a calendar. And then when he gets 10 stars on the calendar, he gets to earn an extra little prize. So for him, that's like, he's really into Legos. So it's like some extra Lego pieces. But if you're trying to manage screen time in your house and what is enough screen time or not enough screen time, or how do you as a parent get a break by being able to have a screen, connecting something really incentivizing like screen time to following the bedtime routine or staying in your bed in the evening can be really helpful. The second intervention that we use a lot in kids 4 and 5, the second idea that we use that a lot is actually this idea of a bedtime pass. So Faven, I was sort of thinking about your question or like how your kiddo just really wants to cuddle you and snuggle and maybe needs you to be there to fall asleep. You can give your kids, you can pick an arbitrary number. I usually pick 5. And you can say you have 5 tickets. I'm going to give you 5 tickets, and I usually hand them like a note card. And each ticket is a get out of bed ticket. So you have 5 tickets, and each time you get out of bed, you have to pass me a ticket. After you use all your tickets, then I'm just going to quietly put you back in your bed, but I'm not going to interact with you. I'm not going to talk to you. I'm just going to shut my mouth, walk you back in your bed every single time. If you use your tickets, you use them. They're not worth anything. But if you save your tickets, at the end of the week, you can cash in your tickets for special extra time or a special prize or a movie night, or you get to pick the dinner that we have. So the idea is the kiddo is incentivized to not use the tickets because they get to cash them in at the end of the week. And then over time, you start only giving 4 tickets, then 3 tickets, then 2 tickets so that you're not ending up letting them get out 5 times. But that's another alternative if you have a kiddo who won't stay for you to say, I'll be back in 2 minutes or I'll be back in 2 minutes. If they just get up right away. And sometimes they can get really excited about decorating the tickets and, make them. Faven says her kid is listening. Maybe this will work. I hope it works. Having your kiddo decorate the tickets is a great idea because then they're invested in the system and what they're doing.
I think she's also.
No, go.
I think I don't want to say where I messed up, but maybe the trauma part of it was I was super high risk, long story short, and she was born sort of early, but small. So she was in the NICU for a little bit. And then it was like during COVID, so I couldn't be at the hospital with her. So in the beginning, it was like as much as the NICU instilled and working in prenatal, it was like, don't co-sleep, don't co-sleep. It was like drilled into me. It's something that I did because I felt like I lost that bonding time. But now we're 4.5 years in, and she's like, no, I want no parts. And it also falls along with the potty training part. Like she does good at during the day, and then at night, it's like the constant wet pull-ups. And then some days she does great, so she gets rewarded. And then some days it's like, well, why don't I get rewarded? I didn't mean to. So I'm just trying to find a balance with getting in her own bed, maybe not her own room. And then also working on two things at this age with the whole hopefully getting rid of pull-ups altogether. But
yeah. I think that is such a common experience for families. Like everyone's story is different, but like there are many, many reasons why it may not be a good fit at different times in your kid's development to sleep independently. And like I said before, like when you turn 4.5 or 5 and mom is now 5 years into waking up 3 or 4 times a night, that's that balance of like, if you're overtired, what does that mean for how you can parent during the day? Because going back to what Ching was talking about in the beginning, just how we are as human beings, we need to sleep. So I think there's a balance. The one thing I would say is that those are 2 huge goals, super important developmental goals, and probably worth tackling one at a time. So I would say like focusing on, cool, you're going to have and fading is a great strategy here. You're going to have your mattress next to my bed. So mommy can sleep and you can sleep. But you can still be right here with me. And then maybe the mattress gets moved further and further out towards the door. I have a kid I work with right now. She's sleeping on a mattress right outside her parents' room in the hallway, like making her way to her room slowly and earning her tickets. So that's okay. But you want kids to be able to feel successful in what they're doing too. So tackling both of those things at the same time, kind of to Audrey's point, like you don't want to sleep train in a secondary stress environment. So maybe hold off on the nighttime pull-ups or be okay with that and focus on the sleep location to start. But that's a great example, Fabian. Thank you for sharing. Any other questions or thoughts about sleep?
Megan, if you can somehow, I don't know, inbox me or something, ways to communicate this kind of information with our families of like from other parts of the country, from the world. Because having a kid sleep with you at this age isn't abnormal to some of us, depending on what part of the world we come from. Um, Having a kid sleep by themselves at this age, kind of like with my mom, for example, she's like, "Why do you want her to sleep in her room? She's a baby."
Yeah,
And it's
for
like
sure.
the cultural part of it, trying to like, if you're not at work, trying to explain that to people, and they kind of look at you like, "What? You want my baby to sleep in their own room?" Like, yeah, it's a part of, the steps of life, but how do you coach families outside of like that are immigrants that aren't immigrants of the US to kind of explain these milestones and when they're appropriate?
I mean, I think that's kind of what we were trying to get at in the beginning, which is like sleep is it varies so much by culture and by what works for each family. So there's no right or wrong way to do this. And I think that's the thing is if what works in your family is to be in the same room with your kids and you're able to sleep safely, that's the most important thing. There's no reason to like push any westernized way of everyone is so independent and everyone has to sleep in this way. Um, if it's not what fits with the family. Usually what I lean on is what helps me be the best parent. And so in clinic, and Audrey and Ching could speak to this too, like in clinic, I am not concerned about families, like, and it's not a concern to me at all if everyone's sleeping in the same room, if they're all sleeping well. It's more about if you're not sleeping well and you think it might be better if you had a little bit of space between your body and your 4-year-old, like sleeping on your face, then like we want to help you get strategies to be able to do that. But by no means should this be communicated as like it's only okay if your kids sleep on their own. And I think that's a big risk of Western medicine is sort of shaming this idea or creating this idea that during sleep, children should be separate, right? Like you need to get your kid in their own crib, in their own room, or you're doing something poorly. And that's not true at all. Like it's all about what feels comfortable and everyone can get good sleep. So yeah, I want to make sure to emphasize that. These strategies are only as useful as like a parent feeling like they need to use them. I don't know, Audrey or Ching, if you'd add anything to that.
Yeah, thanks for the question. I think that's a really important thing to point out, because we don't want to impose Western sleep standards on a family that, that's not going to work for them. And that's just like Megan was saying, totally normal. We want to help support families however they choose to sleep with their kid. And I think part of the like the independent sleep is not so much my kid is in a separate room and they're going to sleep in their own space. But also just if you're a parent and you want to co-sleep with your child, but you need less sleep than them, if you're gonna go to bed at a later time or wake up earlier and your child sleeping next to you just can't handle whenever you're not there, that can be kind of distressing, and kind of hard to manage life because there's a lot that you have to get done as a parent. So it can I think what we're hoping for is that these strategies can be helpful to just empower families however they choose to navigate sleep with their kid, and just like wherever there is that need, these might be helpful. But um, yeah, I guess that's all I would add to that.
Thank you guys, ladies, so much.
We often want to just remind you all that you have Dr. Jackie as your nurse practitioner at Tiny Tots, and these are great questions to start to address with her or with your pediatrician. And you don't have to, this is like a super common thing we help kids with all the time. So even if your kid isn't snoring, if you're, Faith, I'm thinking about you, it's just like, oh my gosh, she needs me just right there. If that is working for you, great. And if not, talking to your pediatrician, talking to your teachers is a great place to start with some of the strategies that, especially if some of the strategies we talked about today just seem like unrealistic or like they're not working. All right, you all, I'm looking at our time here. I think that's it. Is there anybody else who wants to add anything? Chuckwell, did you want to add anything from the Therapy Fund Foundation? I know sometimes at the end you like to chime in, but I'm not sure if you wanted to do that today or not. Sounds like it. Okay. All right, you all. Happy bedtime. You can do it. Solidarity. Thanks for your time today. Oh, and Laura Lee has books for you all. If you want to pick up some cool bedtime books. Laura Lee, do you want to chime in on that?
Yeah, they are in the admin office part. So if you guys want to go and pick out a book, I think there might be even enough for two. Stop by and ask Felicia about it. She'll get you a book.
Thank you, Orly.
Okay, y'all. Take care.
Bye, everybody.
Have a good
Bye.
week. Keep it up.
Bye.
Good job. Laura Lee, can you stop the recording for us?